Hi, I'm Walt Fritz. I'm the director of the Foundations and Myofascial Release Seminars. And I'm here at Oakworks today shooting a video just on what a myofascial release session might look like. Maybe you've been interested in myofascial release but aren't quite sure what it's all about. Now, I'm a physical therapist. This is my primary modality that I use. It's also a primary modality of a lot of massage therapists, so you could be seeing an MT, a PT, or maybe even an occupational therapist or speech pathologist. Myofascial release utilizes a system of assessment and treatment which looks at the whole body. So when you go into a first session with your therapist, don't be surprised if they want to do a full body evaluation, even if you're only having very specific pain. That full body evaluation is going to give them a tremendous amount of information because very frequently the problem doesn't lie just where the pain is. Okay? So it really is important for them to take a good look at you. They may ask you to come in relatively unclothed with shorts and tank top, that sort of thing, so that they can get a look as much at you as possible. Once they do the assessment and then talking over what they find as a treatment plan, they're going to go into treatment. Now, myofascial release can take a lot of forms. The type of myofascial release that I use and I teach and your therapist is using is a gentler form of myofascial release. You're the patient, you're driving the bus here. If anything is ever too much or not right, tell your therapist. If it's still too much or not right, find a different therapist, okay? You do not have to be aggressive. This does not have to hurt in order to be effective. So in Molly's case, she came in with some knee pain. We did her assessment. We found she had a lot of tightness in her thigh, a little bit of pelvic rotation, pelvic asymmetry that we might want to look at, because the pelvis plays a key role in a lot of things below the waist and above the waist. But in terms of treating Molly's knee pain, I found a tremendous amount of tightness up through the quadriceps itself. While the pain is here, I believe a lot of it is caused by the tightness in through the main muscle that goes into the knee. So myofascial release is traditionally done in a cross-handed approach, where the therapist will come in, no lotion or oil, dry skin. They'll gently put some pressure toward the table and spread their hands. You as the patient may feel a little warm, trickly feeling, just a sense of warmth. It should be pleasant. If there is any discomfort ever, it should feel like a good hurt. Molly, what do you feel right now?
Just pressure.
Just pressure.
Mm-hmm.
Do you feel that bit of tension between my hands?
Yes.
Good, good. Now, myofascial release is unlike most traditional physical therapy or massage therapy you've ever had, because the therapist is going to remain stationary for 5-10 minutes at a time. And that's because we want to get multiple layers of the connective tissue, of the fascia, to release or stretch. Traditional stretching addresses typically only the elastic part of the connective tissue and muscle. In an injury, you get the collagen involved. You want to get deeper into the collagen, get that stretched out and released so you get lasting changes in tissue length and lasting changes in pain. After spending 5 or 10 minutes in an area, they may go to a different area, working there. It may be multiple spots in the same area, like that, like this. What should be an integral part of a myofascial release session is empowering you, the patient, to take over your own care as well. So we spent a fair amount of time working on Molly's thigh. I came over and I did the other thigh as well. She had issues with both thighs being tight, a bit of pain, but more in the left side and the left knee. So what I want to do now is teach Molly something that she can do at home. Now, first of all, home stretches for myofascial release should be very comfortable. They shouldn't be aggressive. They shouldn't be painful. So, Molly, how much pressure does it feel like I'm using?
Not much.
Not much at all. No. And that's how it should be. You're teaching your patient just to engage that light, gentle barrier. Now, what I typically do, for instance, this would be a home stretch I would teach to Molly. Now, the traditional way of doing the stretch is doing it in standing, where you grab hold of your ankle, or if somebody has a lot of flexibility, they could reach back. But you can see how much strain it is right there, right? So what I will typically do is attach a yoga strap around her foot, bring it up over her shoulder, and then she'd take hold of the strap here and gently pull the strap until she engages that barrier. We'd spend time teaching what that feels like, that it's not an aggressive, painful stretch, but it's a stretch that I'm going to ask her to hold for probably 5 minutes. Very different from traditional stretching. So each session of myofascial release may look very different, but there's no pre-planned set of order that the therapist is going to follow. There'll be a small amount of reevaluation at the beginning of a session, and then they'll go right into treatment. And hopefully each time the patient will get some either reinforcement of existing home exercises or some new things to take them even further. Myofascial release does not come from a weakness model, which traditional physical therapy views pain. Myofascial release comes from a tightness model. It's the tightness within the body that is creating the pain, creating the pressures that causes the pain. So typically the therapist may not talk to you about exercise. Not that exercise is bad, it's a great thing, but it's often not the cause of the pain. I appreciate you spending time with me today, and you can find more information about my seminars at www.foundationsinmfr.com.